Nervous stomach causes and symptoms. A nervous stomach is one example of how a person's emotion can affect their body. Doctors may refer to a nervous stomach if a person is having symptoms such as nausea or bloating that are unrelated to any gastrointestinal condition. Treatments for a nervous stomach often include techniques to reduce anxiety, stress, and tension. In this video, learn about the causes and symptoms of a nervous stomach, as well as how to prevent it happening again. Symptoms. A nervous stomach can mirror the symptoms of some gastrointestinal disorders. This include conditions such as irritable bowel syndrome (IBS), Crohn's disease, ulcerative colitis, or gastroenteritis, which is a bacterial or viral related stomach infection. Symptoms associated with nervous stomach include bloating, delayed gastric emptying, diarrhea, gas, nausea. Children also commonly experience symptoms of a nervous stomach. They may describe their symptoms differently than adults. They may refuse to go to school or frequently report stomach pain without presenting any other signs of an infection. Causes. The gastrointestinal system has its own nervous system called the enteric nervous system. Nerve endings in the stomach are designed to respond to stress hormones transmitted from the brain. This is part of the fight or flight response, which causes stress hormones to signal the stomach to slow down so that more blood can pump to the heart, lungs, and muscles. People can experience high levels of stress on a regular basis, which can mimic those of a fight or flight response. Some stress-related triggers of a nervous stomach include an upcoming event such as a test or presentation, financial problems, relationship or family problems, divorce, changes at work, moving, the death of a loved one, chronic illness. A nervous stomach can give someone butterflies in their stomach, or even make a person feel as if they need to vomit. Sometimes people call irritable bowel syndrome a nervous stomach. Other names for irritable bowel syndrome include spastic colon or irritable colon. However, a person can have a nervous stomach without having irritable bowel syndrome. This is because irritable bowel syndrome symptoms occur consistently for at least 3 months and often improve with dietary and lifestyle changes. Treatment. A doctor can begin to treat a nervous stomach by identifying the stress triggers in a person's life. Some of the potential triggers that a person might need to address to reduce their symptoms include school, job, work, family, or relationships. Examples of treatments for nervous stomach include therapy. Seeing a psychiatrist or therapist may help a person make changes to reduce the stress in their lives. No one can eliminate stress entirely, but a therapist can also help a person identify ways to better cope with stress when they do experience it. Medications. In some instances, a person may need to take medicine to reduce their anxiety and stress levels. Treating anxiety and depression may also help to reduce the incidence of nervous stomach. Meditation. Meditation can reduce anxiety and stress by enhancing a person's focus and mindfulness. Meditating involves sitting or lying down in a quiet room and focusing on one's breathing. Some people may choose to repeat a mantra to help them focus their energy and relieve stress. Taking even 10 to 15 minutes a day for meditating can help a person reduce their nervous stomach symptoms. Foods. Avoid foods that can worsen a nervous stomach. Examples of this include dairy products and caffeinated beverages such as coffee, chocolate, soda, and tea. Stress relieving activities. Engaging in activities that help reduce stress, such as exercising, journaling, reading, listening to music, or talking to friends, can help. Sometimes a person may also find they can relieve stress by reducing the number of commitments in their daily schedule. Use natural remedies. This include ginger, which can be sipped as a tea, chewed on as a root, or taken as a supplement. Drinking peppermint tea or smelling peppermint oil may also reduce nervous stomach symptoms. A doctor can also recommend specific treatments according to a person's individual health history. A nervous stomach can cause symptoms that are similar to chronic gastrointestinal disorders. If a person experiences these symptoms on a regular basis, a doctor may diagnose the person with irritable bowel syndrome. Treating any underlying stressors may help reduce the incidence of nervous stomach, alleviate symptoms, and improve a person's quality of life.